Imagine if the simple act of washing your face or putting on makeup caused extreme pain in your face. Unfortunately, that's what happens to some people suffering from a condition known as TN. Details and treatment in tonight's Your Health Report.
Working for you in the spirit of Arkansas, this is Channel 7 News live at 5 with Heather Crawford, Scott Inman, weather with Chief Meteorologist Ned Permy, and sports with Steve Sullivan.
After the break, more on a condition called TN.
It makes even simple tasks like brushing your teeth extremely painful, but you don't have to live with that pain. Your Health Report is up next. In tonight's Your Health Report, a closer look at a condition that sends shooting pains like electrical shocks through one side of your face. It's not a toothache, but it's sometimes misdiagnosed as a dental condition, and it can be set off by something as simple as brushing your teeth or putting on your makeup. But patients don't have to live with this painful condition thanks to advances in surgical techniques. Becky Reynolds of Clarendon has lived with extreme pain in her face for the past 2 years. She says the first time she was hit by the pain, it took her to her knees and scared her kids half to death. She thought the pain was caused by a bad toothache, so she had some teeth extracted. But it turns out her teeth had nothing to do with it.
Because the pain never went away, and it started progressing, getting, to where it started out as episodes that lasted like 3 or 4 seconds, to where I would just hit my knees, grabbing furniture, anything I could grab.
We caught up with Becky just a few minutes before she went into surgery at St. Vincent. Her doctor, Scott Schlesinger, says she suffers from a condition known as trigeminal neuralgia, also known as TN. It's dubbed the suicide disease because patients who experience the extreme facial pain often say they would rather be dead than live with the condition.
I am looking forward to just one day with no pain whatsoever, to wake up and be able to eat a whole meal without just taking a few bites and having to stop.
What's key is it's not a constant throbbing pain like a toothache. It's not there all the time. It comes and goes in very brief spurts, almost like somebody's hitting you with a taser over and over again to your face, and that's characteristic.
Dr. Schlesinger says Becky's pain is caused by her main facial nerve rubbing against or being pressured by an artery. So he will perform microvascular decompression to relieve that pressure and reduce or eliminate her pain.
A small area behind the ear where we go into the area of the brain where the nerve to the face, called the trigeminal nerve, runs from the brain to the face. And we usually find in that area a blood vessel that's hitting the artery, causing this terrible neuralgic pain to occur.
A couple of weeks after her brain surgery, Becky has her follow-up visit with Dr. Schlesinger.
You have made a total change in my life. Oh, you really have.
Well, I'll take a hug.
Oh, yes.
Becky's surgery has been a success. She's now living pain-free for the first time in 2 years. And she's hoping that trigeminal neuralgia is a thing of the past.
Not one pain since surgery, not one shock. I've been eating ice cream. I have not been able to eat ice cream in 2 years.
Dr. Schlesinger says the decompression surgery is one of the most rewarding procedures he performs because in most cases it offers his patients instant pain relief. In fact, he says about 95% of patients get relief from their facial pain.
And after this surgery, the vast majority of patients are the happiest people on earth. They're so gratified that they're free of somebody hitting a taser to their face repeatedly over the course of a day. So it's a very gratifying operation, and patient population is so happy to have this.
And we have linked St. Vincent's website to ours. Just visit KATV.com and look under News Links.